Hello, friends. Welcome to the session of Conceptual Spine Connect today, where we are going to talk about scoliosis. When we talk about the scoliosis, there has been a long history. The history has been, in regards to the line of management, long uninstrumented fusions to the implants, to the 3D biomechanical understanding and the concepts of stability, how to classify them, how to treat with them. So, Hippocrates was the first person who actually historically started talking about all these things. And in fact, he was the first person who, tried to understand, the patients are developing deformity in the spine. That was most commonly secondary to the infection. And they try to strap the people, they try to, somehow give some countermeasures so that, they try to straighten the spine by all those things. They also try to understand what is the reason of the deformity and how can we possibly go ahead and do the correction. So historically, this all happened in the year 460 to 370 BC. They basically did try to, straighten the spine also via some maneuvers in which they try to, get the spine straight. They try to hang the patient. They try to strap the patient. So a lot of things were done by them in order to try and straighten the spine. In the year 1911, Russell Hips basically started talking about the long uninstrumented fusion. And they, just try to fuse the spine and they went long for that. And there was no inventory as such that they used. Paul Harrington basically started using the implants for the first time in the year 1962, wherein the implants were first started, the famous Harrington rods. The In the year 1970 to the present, we have been started talking about this deformity in the three-dimensional aspect. We have been trying to understand the biomechanics, the stability, and how should we possibly deal with this. So the latest thing that I would say what happened in the 1970, and we have been trying to develop on that further and further. As per the definition, scoliosis is an abnormal lateral curvature of the spine. According to the Scoliosis Research Society, idiopathic scoliosis is a curvature of more than 10 degrees on a standing X-ray. Curvature of less than 10 degrees of the corpse, that would be just to be said, asymmetry of the spine. However, one important thing is that this all definition is a misnomer, because when we talk about the scoliosis, it's a three-dimensional deformity and abnormality which involves all the planes. And just telling that it's a 10-degree lateral angulation doesn't do justice to the actual underlying problem. So how do we say about this condition? So we actually should say it is possibly a three-dimensional deformity where all the biomechanics are altered in all the planes. So what are these planes? The axial plane. When we talk about the axial plane, it is the plane which you will see from the top down. So there is an element of rotation that is there in this axial plane. So as you see in this image, as you see the spine from the top, all this is rotated. The spinal column is rotated. If you imagine a stack of coins placed one above the other, and if you keep rotating everything, this is how the deformity of the spine will develop. The second thing is the coronal plane, where we talk about the lateral curvature of the spine. So this is the coronal plane, which you see from the front, and the spine is not straight and it is bent towards the right or the left side, maybe proximally, distally in one of the areas of spine. So this is how you have the lateral curvature of the spine when we talk about the coronal plane. The sagittal plane is the kyphosis. As you see over here in the sagittal plane, or when you see from the side, side over here like this, over here you will basically see a crooked back or a humpback, which is basically the kyphosis of the spine. And hence, this particular deformity is in three planes: the axial plane, the coronal plane, as well as the sagittal plane. And when you just tell that this is a lateral angulation of the spine beyond 10 degrees, won't do justice to it, and this is a three-dimensional deformity. Now, the justice can be done when you will see this deformity in all the three planes: the axial, the coronal, and the sagittal. And if you just say this is a lateral deviation of the spine by 10 degrees, which you basically try to say something over here, what happens to the axial and the sagittal plane? So this also has to be given due consideration. And this is a reason why this is considered to be the misnomer and the definition doesn't hold completely true. Incidence. So the scoliosis can develop both in the infancy as well as in early stage. The primary age of onset is generally between 10 to 15 years of age. females are 8 times more likely to progress to a curve magnitude that requires treatment. So scoliosis is not something that will immediately happen from birth. It may, but along with that, it is something that may happen in infancy, or it may develop in early age also. The primary age of onset would be between 10 and 15 years. Females are likely to have the curves that are going to progress, that are going to require treatment 8 times more commonly as compared to males. Now, scoliosis can be a structural thing or a non-structural thing. The structural thing can be a idiopathic or a neuromuscular. Non-structural scoliosis we are not worried about. The structural scoliosis is the one that we are worried about. In the structural scoliosis, along with idiopathic neuromuscular, you can also think of mentioning congenital as well. So these are the different scoliosis which may be present. Structurals are the ones that not completely correct. Non-structurals are the one that correct on the bending films. So non-structural scoliosis. So what is this scoliosis? So it is basically a scoliosis which is also called a functional scoliosis. So it is also called as a functional scoliosis. It's only a temporary cause. It goes away secondary to the postural abnormality, the nerve root irritation, inflammation, limb-length discrepancy, contracture of the muscles, compensatory pelvic inequality, abnormal foot arches. So, a non-structural scoliosis basically might be a scoliosis which is not coming out to secondary to a problem in the spine, but it may be because of any other problem otherwise. So what are those different things otherwise? So a different abnormal posture. So even a postural abnormality can cause the deformity in regards to the scoliosis. And this cannot be considered to be a structural problem because it is not coming from the spine. Any small amount of nerve root irritation might also cause the patient to have a deviation of the spine from the normal, and that would be a non-structural scoliosis, or it may be a list also. Inflammation can also cause, some amount of scoliosis. Limb-length discrepancy, contracture of muscles can also cause the scoliosis. Compensatory curves can cause scoliosis. Any problem in the pelvis, which is causing the inequality of the pelvis, can also cause the scoliosis. When the foot arches are not normal and they're abnormally very high, that will also cause this non-structural scoliosis. So there's a concept of postural scoliosis, wherein the body segment alignment is something that takes a toll. Now, whenever we talk about the body segment alignment taking a toll, the spine may curve to the right or to the left, may have a single or a double curve. Ribs may also protrude or may be depressed on one of the sides, which might cause the hollow and the hump. On the forward flexion, the patients may have a short leg, the pelvis may be tilted laterally, concave side may be higher, shoulder and scapula may drop on the concave side of the curve. So when the body alignment is not completely maintained, the patients might have this postural scoliosis. Whenever the muscles are elongated or weak, that in those conditions, the muscles, whenever the muscles are when the patient doesn't have a scoliosis, the muscles on both the sides of the spines will be working equally. However, whenever there is a discrepancy because of the deformity, the muscles on the convex side will and the concave side will not work normally, and the ones on the convex side, they will get elongated and they will become weak. Hip abductor muscles, they also will get impacted on the concave side, and the foot muscles on the pronation axis of the pronator muscles will also get affected on the long side or the convex side. Muscles that become short are the ones on the concave side. Adductors also get impacted on the convex side. Supinators also get impacted on the short side or the convex side. Joints that are commonly impacted: lumbar spine, thoracic spine, pelvis, hip joints, foot joints, scapulothoracic joints, glenohumeral joints, cervical spine. Patients might also have torticollis, atlanto-occipital joints, temporomandible joints. So all these problems can also cause some amount of change in the shape or the posture, which will cause the postural scoliosis. So this is something that you have to remember, that not just a problem in the spine, but some problems otherwise also might start causing the development of the scoliosis. Now, when we talk about the structural scoliosis, that is the main scoliosis that we talk about. It is the most common types. It affects the spine structure overall. It's a permanent kind of a thing. Side to side and rotation does get impacted. It does not disappear, and it primarily indicates some deformity. Secondary to a neurological or a muscular disease.